Vaccine experts for the CDC will vote tomorrow whether to recommend the first COVID-19 shots for kids under 5. Here to answer your questions is Dr. Vandana Madhavan, Clinical Director of Pediatric Infectious Disease at Mass General Hospital for Children. Dr. Madhavan, thanks so much for being here with us.
My pleasure.
All right, Dr. Madhavan, as you know, earlier today, the FDA authorized the vaccines from both Pfizer and Moderna for kids as young as 6 months. So what is left here really for the CDC to discuss, and do you have any doubt that they'll sign off on this as well?
That's a great question, and I think the key word is vaccines. So for the first time in the pediatric population, we have two different options, because before Pfizer was the only option. It went down to 16 initially, then down to 12, then down to 5. But now for the 6 months plus, we have two options. And so that's what the Advisory Committee on Immunization Practices, a committee from the CDC, that's what they'll be debating, because the Pfizer vaccine, if you recall, it's 2 initial doses, 3 weeks apart, just like the vaccine for older children and adults. But then there's a third dose a couple months after that second dose. So it's a 3-dose series to be considered complete. The Moderna vaccine is 2 doses, 4 weeks apart. Both of these, vaccines have lower doses than in older children, and adults, and they've both been extremely safe in trials. They are both effective against the ultimate endpoint, which is severe hospitalization, severe disease, and that's what we're really focused on. We still don't have a lot of real-time information about how effective they are against Omicron variants, but we know they're effective against what really matters, protecting children against the most severe complications. But what will be debated is, should both of them be equally recommended? Is there any nuance to the fact that one requires 2 doses versus 3 doses, et cetera?
Okay, well, many of us have heard that little kids, the youngest among us, have the lower risk of developing severe symptoms from COVID. But with the new variants, is that still true? Are some getting sicker?
Great question. So overall, yes, little children, especially the youngest children, are still getting hospitalized, having severe complications at lower rates in older children than adults. But because of the Omicron variants being so transmissible, it's been a numbers game. Things have opened up. People are not wearing masks. They're traveling more. They're gathering more. They're returning to old activities. And so more young children are getting sick, and therefore more children are getting admitted. And I also do want to emphasize that in the under 5 age group, there have been over 400 deaths since the start of the pandemic. And that's more than any other vaccine preventable disease combined. Yeah. And so while it's a lower risk, it's still not a zero risk, and it's still higher than, say, influenza, other diseases that we have vaccines against.
Dr. Madhavan, let's continue that theme. Let's compare this to a couple of the other, because, kids get a range of vaccines in that 6 months to kind of 4 or 5 year old age frame. So let's compare COVID, the risks of COVID, to say polio, measles, mumps, any of those other vaccines that parents generally give their kids and don't think twice about it. What's the risk difference, those illnesses to COVID?
Great question. Polio, you are at basically zero risk of contracting polio in the vast majority of countries around the world. But that's why we keep giving polio vaccine, to make sure that it stays eliminated. But whereas COVID, we know that it's in every inhabited, continent. It's everywhere. The risk continues. And unlike all of these other diseases that we have vaccines against, COVID is still a new illness. We still have only been learning about it for a little over 2 years. So we still can't say that, oh yes, people have COVID, and if you don't get MIS-C, the multisystem inflammatory children associated with children, or you don't get long COVID in the first couple months, you're fine. We really can't say that children 5, 10, 20, even more years down the road won't have complications from having had COVID as a child. So it makes it even more important to get kids protected as soon as they're able.
All right, Dr. Vandana Madhavan from Mass General, thanks so much for joining us.
We hope you're giving those vaccines next week. Thank you.